Hi, everybody, and welcome back to another episode of Hybrid Healing Hour. Today, we're going to be talking with a special guest, Dr. Yani, who is a biological dentist, and we're going to be talking about dentistry from a functional medicine perspective. And I'm really looking forward to this because I think a lot of people out there don't know about a biological dentist, and I would love for you to basically introduce yourself, tell our audience a little bit about yourself and how you got to where you are, and then we're going to dive right into it.
Sounds great. Happy to be here. Thank you. As far as my dental career started back in the 90s. Oh my God, that's gonna disclose my age. I went to dental school in University of Sao Paulo, Brazil. After graduating, I practiced back in my hometown in Bolivia, and a year later, I moved to the United States and went back to the university to pursue my postdoctoral studies and advanced education in general dentistry and special needs patients. And after that, in order to practice in the U.S., I had to go back and do pre-doc. So there you go. I had to repeat the whole journey, and I graduated from Nova Southeastern University in 2006.
Okay.
Yes, and now,
then you stayed in Florida since then?
Yeah, very Floridian.
Okay.
You know, after living in tropical countries like Brazil, Bolivia, I have to be in Florida.
Yeah,
I don't do well with cold. So biological dentistry, what is? A lot of people ask me, what's biological? Well, biological is the relationship between the oral health and the overall well-being from a not only physical, emotional, and physical as well, element that we treat in our office, paying attention to patients' past traumatic experiences at dentists, and being able to provide a comfortable environment where they can thrive and where their own natural healing mechanisms can be activated. We firmly believe in biocompatibility, minimally invasive procedures, and providing alternative methods in order to decrease inflammation, detoxify the body by removing heavy metals. And a key element, too, is a open communication with a integrative functional doctors where they can help us together, you know, create that healthy environment that we're looking for to activate and upregulate the immune system and detoxify our patients to reduce their chronic inflammatory conditions.
I mean, that sounds right up our alley, and I feel like, well, who wouldn't want to go to you? And so my biggest question is, what made you pursue, one, dentistry, and two, what made you do not just traditional dentistry and then go into this? Like, how did you learn about it, and what drove that passion?
Well, that could be an entire book. Well, early on, as a child growing up, I was diagnosed with a lot of cavities. Of course, I grew up in a farm that my dad owned, and you know, eating a lot of sugary elements like sugar cane. And I developed a lot of cavities. My uncle was a dentist, and he put a lot of fillings in my mouth. This is by age 8 or 9. And something interesting that triggered in me in the last 20 years, trying to go back and figure it out why I was so ill. I was diagnosed with hypothyroidism early on when I was 10 and put on thyroid medication. And my parents, I mean, God bless their heart, you know, they were doing the best they could do to offset all the cardiogenic processes going on in my mouth. And at the same time, I was prescribed fluoride pills systemically. Second, I was put in silver, so-called amalgam mercury fillings. And what's the result of that? Endocrine disruption. So ending with thyroid condition, taking medication, and not until I go to dental school in Brazil that we start working on each other, removing all the ugly silver mercury fillings out of our mouth, then my body starts healing. When I go back to my checkups with my endocrinologist, he said, well, your T3, T4 levels are perfectly normal. I think I'm going to take you out of the medication. Well, at the time, nothing clicked in my head that could have been related because I got all that junk out of my mouth. I did not put one and one together. I go through dental school here in the U.S., and part of our education is completely avoided talking about the toxicity of these elements. I mean, they don't even mention the fact that the predominant alloy in silver fillings, it's mercury, up to 50 to 55%.
Wow.
So if you're being told, hey, would you let me put a mercury filling in your mouth? Would you do it?
No.
I said, absolutely not. It's one of the most toxic elements to humankind. Why would I want to have it in my mouth? But that's the system, that's the government, and that's the American Dental Association that support these type of fillings. Okay? So that's when we talk about insurance-driven patients. Oh, is my insurance going to cover it? I don't play those games.
Right.
I mean,
you're out for the better good of your
I'm
patients.
focused on my patient's well-being. If I play the insurance game, I have to put those fillings. And if I put different, more biocompatible materials in their mouth, they're going to downgrade paying a minimum portion of that. And that's what I said. This is not what I want to offer my patients. I want to offer healthier options where their own body can start healing.
So go ahead.
So many of our patients come to us and they tell us, we went to see our dentist to get our fillings removed or changed, and the dentist is reluctant to do it. So it's very hard for people to find someone who's willing to listen to them. And now people are becoming more in tune with the functional medicine realm and with toxins and with these mercury amalgams.
I think they're becoming more educated, right? And that's obviously one of the reasons why we're doing this podcast. We want that awareness out there to know exactly how they can be endocrine disruptors, like you said, and all the possible like terrible side effects of how it affects the entire body, right? So this is great, and I definitely, can you restate that certification that you have to properly remove the mercury? That you're training?
There's a protocol called SMART, Safe Mercury Amalgam Removal Therapy. It's provided by the International Academy of Oral Medicine and Toxicology, IOMT.org. And I'm an accredited member of it. And those are the protocols that we follow in our office. Because, to be honest, why dentists don't even want to remove it? Because they know by drilling on those metal restoration, they're producing high levels of toxic vapors that is not only a hazardous vapor to the patient who inhales it, but also to their dental assistant, the hygienist who polish them, because mercury at room temperature, it's a liquid metal. Above room temperature produces toxic vapors that by inhalation goes to the respiratory system, and from there dissipates into the entire body circulation. So I tell patients, if you have mercury in your mouth, you have it in every single cell in your body. That's what we need to work with a professional, functional integrative doctor that can help you detoxify this. Open pathways of detoxification from the liver. And this can take up to a year to a year and a half, according to the research, for the liver to start functioning properly and to improve our production of mitochondrial glutathione.
Exactly.
Because this is where it gets compromised. If you decrease your production of antioxidant, then it breaks havoc in your immune system, and you increase inflammatory levels in an exacerbated way.
Exactly.
So the other side of my medical history is the fact that by age 16, I wasn't getting my period, and my mom brought me to the OBGYN, and they told, oh, your daughter did not develop her uterus, and she'll be infertile.
Oh, my.
So it's like, okay, I was a very career-driven, summa cum laude student. To me, I wasn't even focused on that option. But my last semester of dental school, I ended up pregnant.
Wow. After you had
What's
the mercury
the
and
common
amalgams, yes.
denominator? Metal came out of my body. Luckily, because mercury fillings, they cross the placental barrier. And that's the first exposure of mercury to your offspring. And imagine mercury, a very toxic metal, a neurotoxin, affects the neuronal development, brain cells,
Absolutely.
So it's key for patients, especially when they're considering have a family, to get those mercury fillings removed. And after our COVID pandemic, the FDA even changed the labeling in the formulation of the
vaccine. They changed the name of mercury.
Well,
right?
in vaccines, it's called thimerosal, which is an organic compound. Okay. And this is another subject, but it's very interesting too, because vaccines have thimerosal, which is an
preservative.
Yes, and preservant in vaccine. But in the metallic form, mercury is very difficult to eliminate and secretes once it crosses the cell membrane, because it becomes a thimerosal form, an organic compound called ethyl mercury. That's the importance of working with doctors, that we both can help patients detoxify.
Are mercury amalgams still being used today, or did they stop them?
Yes, it's part of what insurance pays, and it's part of the government system that helps in underdeveloped areas and all that.
Are there other type of amalgams that can be used instead?
I would not recommend any metallic restoration in the mouth, for the simple fact that nowadays, wherever you go, you have your smartphone, there's routers, there's modem, and metals or different type of alloys will create what we call a human battery. They amplify and increase the EMF and ionizing radiation to the brain. So I'm just waiting to see what are going to be the future studies and results based on this amplification of EMS and ionizing radiation with patients have higher content of metals in their mouth.
I'm actually a big believer of EMFs. In fact, I'm wearing my Lila, which is an EMF blocker right now. And I agree with that. I mean, there's a lot of people out there who say you don't have to worry about EMFs if you don't have metal in your body. But think about electromagnetic field and metal, like it attracts, right? So if you have metals in your body, you're gonna absorb all that energy, right? So I find that very interesting. So I've done a heavy metal detox, and I know I still had some mercury in my system because I did a pre-test and a post-test.
How was your exposure?
So they think it's just fish. I was eating fish like tuna, canned tuna, and salmon, probably like at least twice a week, maybe probably like 3 times a week. And so I eliminated, I even tried going to like what they call shallow water catch tuna, like because they're like a hand
they don't
hand
grow
catch.
as big.
Right, they don't grow as big, but I just eliminated all canned tuna completely. Okay. And then I actually eliminated all fish for over a year now, and I rarely eat it. But yeah, it was quite interesting. But luckily I am able to detox. So the testing kit that I go through a company called Quicksilver, and I like them because they do blood, urine, and hair, and they check to make sure you're detoxing as well. Because if you're not able to eliminate it, then that's a whole nother thing you need to work on, right? Exactly. And like you mentioned, your liver has to be able to process it through the different phases of detox and be able to eliminate it through your stool.
Yeah, and it's important that you guys do both, all three. I know the owner of the company that developed the testing, because the IOMT is a big proponent of that test as well. But it's very interesting to know, because a lot of people do only the hair test, and the hair test is not conclusive. Because if you don't have any heavy metals in your hair, doesn't mean that you don't have heavy metals in your body. Right. It means that your inability to detox, to secrete this toxin. So that's something to be aware. Porphyrin urine test is an ideal test to check the status on your kidneys.
And then that's the other thing. You know, a lot of people just go to the Quest blood panel, and I'm like, that is not accurate. It's very inaccurate.
I want to pull my hair when I see even D3 levels normalized at a level of 25. Right. And I said, we couldn't even put a zirconia implant if it's not about 50 or 60. You know?
And that's the other thing. Like, we did a podcast on normal like lab levels too, and our
Versus
one of our
optimal.
very first like optimal lab levels versus quote unquote normal, right?
Cannot follow Quest.
No,
Nope.
exactly. And so that's why I tell people, I'm like, just because your heavy metals are normal on their panel doesn't mean anything. Now, if they're abnormal, if they're high on Quest, then that means they're probably off the charts otherwise, you know? And so I would definitely recommend a detox then. But yeah, I actually like the Quicksilver Detox kit that they have. You don't have to do the whole IV chelations, but that is an option that people can do. We don't do that in our office. I personally did not enjoy it. So I went the route of the whole sublingual detox.
I encourage patients first to start with the least, because chelation by
Yes,
MDNS
and
and
EDTA.
it can be toxic too.
Yes.
And, it can mobilize toxins from inside of the
can
cell
move
to
them.
different compartments.
Exactly.
And then you cannot trace them back. And it doesn't mean that you're eliminated. So you got to be very careful. It has to be done by somebody who's knowledgeable about it. But taking binders, it's a good start.
Right.
And a lot of people ask me, should
Like
I do
charcoal.
it before or after? Activated charcoal, we even provide the patients when we do the safe mercury removal protocol after. I prefer that they don't take it before because it interferes with the onset and duration of anesthetic. So I tell patients, don't worry, we'll give you activated charcoal, but at the end of your procedure to reverse
Interesting.
the anesthetic. Because if you take it before, the anesthetic might not make a profound effect, and I'd rather not do it. So before that, but that's a great binder
Yeah.
for detox.
What about other types of dental implants like crowns, braces, things like that? Are they safer?
Well, you know what? I do a lot of Invisalign in my practice, and our concern is always, okay, what's the latest and greatest material that we're going to put in your mouth that won't have a physiological toxic effect? Now, the problem with metals, that's where I stand, and also the high levels of allergy towards nickel. The problem with braces, brackets, they're made of stainless steel. Stainless steel has nickel. 70% of the population are sensitive to nickel. So this is something to consider. Of course, if you're dealing with children or teenagers, you want to start doing growth and development of the jaws early on to provide, open airways and proper oxygenation to minimize also behavioral problems and learning disabilities. So orthopedics, they're all appliances done with nitide. Nitide are the wires, nickel titanium. That's something that we cannot avoid.
Okay.
But we're in a stage where kids can bounce back.
I was going to say it's temporary though, right?
It's temporary.
Yeah, they're only wearing braces for,
I'm
how
more
long?
concerned with the adults being exposed to a higher load of metals. I would say, okay, kids are not on smartphones, but no, that's not the truth. Now kids are addicted to smartphones probably since they're 3 years old. But you have to outweigh your risk and benefits and everything.
Now, I would like to also talk about plastics, right? So my thing is, a lot of people are now doing Invisalign, or there was Smile Direct. I feel like there's so many different makers now of these aligners to straighten out your teeth. Are those toxic? Because I want to I'm always trying to avoid BPA and all these. What's a safe one?
Well,
because
the
you're
only
wearing
one
them
I
all
can
the time.
talk, and I'm a proponent, is Invisalign.
Okay.
Because I'm a provider for Invisalign, and they certified to be BPA free.
Okay.
And they've been the pioneers in clear aligner therapy for many years. I'm a provider since 2007, and I see the evolution of the materials, the software, how they equate inflexibility to move teeth equals nickel titanium wires that you will put if you are doing conventional orthodontics. So it's very effective. As far as BPA free, now this is a vast concern.
Yeah.
Yeah.
Because BPA has different categories too. And this is when we can go back to even floss, We floss, and new studies showing also the presence of PFAs, phthalates,
Yes.
in your conventional floss. So we're trying to move more towards natural products like silk, bamboo fibers, natural fibers to improve your oral home care and hygiene and prevent the absorption of these forever microplastics that are being found in the brain, being found in atheromas inside of the vascular bed of arteries. So that's a concern, despite the add-on fluoride as well, because that's another subject, and it's being right now very controversial because we see a lot of cities and municipalities removing fluoride because a recent federal lawsuit which is proving that fluoride reduces IQ, is a hormonal and neurological disruptor as well. And I'm very happy that we're moving in that direction because that should be a choice. We don't want it in our water, especially we live in Florida where we drink copious amount of water to keep ourselves hydrated in a higher humid temperature state. So our consumption of more water means more higher levels of fluoride per particles per million, going sometimes above the EPA
recommendations.
Yeah.
Wow.
Definitely.
So if we're going to cut out fluoride, because yes, I use a water filter to get rid of pretty much everything, right? And my whole house is filtered. And then I use drops. I have like
trace minerals.
Trace minerals,
yeah,
exactly.
You have
That's
to
the brand.
replenish that because through reverse
minerals.
osmosis, you're taking all the minerals, and
Exactly.
you still need your magnesium, your potassium.
Is there anything else that you recommend for remineralization? I've heard a lot about this, like xylitol in chewing gum. Is that
Xylitol
true?
is great. It's a sugar from birch tree. Actually, that was one of my clinical tables when I was in dental school. Funny that you ask. And it shows a great potential to kill carcinogenic bacteria, creates apoptosis. So bacteria cannot metabolize this type of sugar, and thus it doesn't have a carcinogenic or cavity-producing effect. The other one in natural toothpaste that we're recommending is the hydroxyapatite. Now here comes an interesting controversial subject with hydroxyapatite, which is the nanoform. And the nanoform was conceived and fabricated through NASA. The problem with nanoparticles is that they cross the cell membrane and they tend to form a they call it like a, not knife filament type of formation of crystal that gets deposited in the kidneys. They claim that it might be affecting your brain, your general cells, and even blood cells, and might cause cancer. So it's recently been banned in Europe in November from the recent studies coming up. I still recommend hydroxyapatite, but in a natural form, not in the nano form, to have the benefits of the remineralization process and buffering of the pH of saliva as well. But for the most part, I go more for the Ayurvedic basis with more healing bentonite clay for your paste, that you can make your own toothpaste mixing healing bentonite clay, which is a binder too, helps you detoxify. You can add non-aluminum baking soda. Non-aluminum baking soda, because aluminum is another culprit also that crosses the blood-brain barrier, linked with degeneration of the central nervous system and worsen cases of Alzheimer, Parkinson, MS. So that's so many things to worry about.
And I guarantee nobody's really looking at the ingredients of their toothpaste.
No.
I always do, because I also try to avoid SLS, because that's...
sodium lauryl sulfate.
Yeah, and people don't realize, when people come in, they're like, oh my gosh, I just keep getting canker sores. I'm like, stop the SLS. And all of a sudden, their canker sores go away. People don't understand it's such an irritant.
Yep.
Yeah.
Is there a brand of toothpaste that you would recommend, or a type of toothpaste you would recommend, other than making your own?
There's so many great toothpaste coming up that is difficult to keep track, but one that I've been using for many years personally is Himalayan Botanic, and you can buy it on Amazon, really affordable.
I already did.
Yeah.
And I've been using it since my husband met with you.
I love it. I mean, I still I like that minty flavor, but knowing that the ingredients are healthier, they have also the hydroxyapatite added on Himalayan botanic, and that's the natural form. Because I'm looking for toothpaste not to have carrageenan, SLS, the sodium lauryl sulfate, which is the detergent part what causes the foaming effect, but also that's what causes oral dysbiosis, because it will create a negative impact on your natural oral microbiome. So even that, we want to be more cognitive about what we're putting in our mouth, because we want to feed good bacteria. Another great one is from Dr. Curatola. He's a biological dentist in New York, and he created this paste that even have pre and probiotics. It's called Revitin. I hope I'm pronouncing it right. I used to call it Revitin, but it's Revitin, I guess. But that's a really good toothpaste as well.
Does that one have, is that like an orange one?
Yeah.
I think I have that, actually, and I did that too.
And now I think they added to the
I think there's actually vitamin D in it too.
Vitamin C as well,
yeah.
You know, which is important because you need vitamin C for production of a collagen to sustain healthy gums.
Yeah.
So.
And something that's ignored a lot is the tongue. Right? And
yes.
What's your feeling on copper tongue scrapers?
I love it. And that's Ayurvedic as well. The copper tongue scrapers are ideal, but don't overdo it. Because if you overdo it, you're wiping out nitric oxide reducing bacteria.
Ooh. And nitric oxide is
you
wonderful.
Want it
that's
to
great for
prevent
heart
cardiovascular
health.
disease.
Yep.
You know, that's your key vasodilator, improves the health of your gut microbiome and controls your hypertensions as well. I recently testing that even in my dad, because my dad has been a hypertensive patient for years, and he's having it on the normal medication. I say, Dad, I'm going to get you out of the medication. We're going to start taking nitric oxide. And of course, also as part of my own family experiment, 10 years ago, my dad had 2 episodes of stroke back-to-back in 2014, 2015. They moved to the United States, and the first thing I did is take a CT scan, diagnose the presence of any dental infection. He happened to have 2 root canals that were infected. We removed it. My dad's blood pressure has never been more stable than ever, and the fact that there's no dental infection, there's no additional burden causing more chronic inflammatory conditions or potential TIAs or heart attacks. And
that's another question. I mean, that's going right back to the whole oral health and whole body health, right? How inflammation in the mouth can be linked with so many things. So as you've already mentioned now, heart disease, fertility issues, endocrine disruptors in general, like with hormones in any way, including your thyroid, and then diabetes as well. Have you seen anything or any correlations with that?
Yeah, absolutely. And we see the correlation with the worsen your condition of gum disease, or what we call gingivitis, has a progression into periodontitis when the inflammation of the gums start affecting the bone support of your teeth, and you start losing bone, you start losing gums. That patients that they don't have a stable A1C, they tend to have more bone resorption, more bone loss, and more uncontrolled inflammatory picture of their, not only the diabetes, but also the periodontal disease. You treat periodontal disease, NYC levels stabilize. So you need to control both. If you control one, it helps the other. They work synergistically. So we try to put our periodontal risk patients in a frequent recall to disrupt that anaerobic gram-negative microbiome that tends to overpopulate once it's past 90 days. Once it past 90 days, these bacterial colonies becomes more complex. They utilize the food that you eat to produce more endotoxins, which activates a cascade of inflammatory events and more markers of inflammation, like we see in C-reactive proteins, cytokine, and storms.
Cytokine storms off the chart. Yep. Wow. That's why I was going to actually just ask if there was any like biomarkers in the blood, because we check C-reactive protein, and sometimes I have people who just have this constantly elevated CRP, which now I'm thinking we need to definitely, I've always known, right? I've always known the connection with dental health or oral health and and chronic conditions, but it's something that I think we're always looking at, like the gut and many other influencers, right? But oral health is huge. And I know at one point I heard that if you have poor dental hygiene, it can take 7 years off your life. Do you have a different statistic, or have you?
No, it sounds about right.
Yeah.
And the other thing is also airway obstruction because of crowding of teeth or tongue ties can shorten 10 years their lifespan.
Wow.
So that's another aspect that we see in terms of expansion and orthotropics when we deal with patients or kids to have growth and development.
And going back to the microbiome, is that something you actually, can you test the oral microbiome?
Yeah, you definitely can. I mean, in the office, I'm going to start doing the nitric oxide testing.
Are you going to do the test strips?
It's not a super conclusive test,
right?
But it's a good indicator. If you start supplying with nitric oxide, which declines up to 50% after 40, I mean, definitely I tell patients it's a good start to help you. I mean, most of my patients, they're already on probiotic. When I have a persistent case of dysbiosis, I said, okay, let's work with the doctor. Let's make sure that we're not dealing with H. pylori, GERD.
Is the oral microbiome completely different than the colon microbiome, or are they similar?
This is a really good question that you're asking me, because I had even a patient that she insisted, well, she was a microbiologist and she was testing herself. She came to my office and said, I read about infections in the mouth. They can affect the microbiome, the oral microbiome. And I want to analyze if that could affect the intestinal microbiome. I think there is strong correlation. I never heard about the end result of that, but in her case, she had an infected tooth that we diagnosed with the CT scan, and we ended up extracting. The patient ended up healing. But I never heard about the following research. What we see, though, that you can do DNA sequencing, microbiome sequencing, to determine the dynamics and the diversity of the microbiome in order to, promote a healthy microbiome. Now, microbiome in the mouth has been recognized to be present in heart valves and arteries.
Yes. I was going to say, I know I've heard and read how the microbiome of the mouth, the same bacteria that cause cavities and plaque buildup in the mouth are actually the same bacteria that can create plaque and calcifications in the coronary arteries.
Yeah.
So that's where that's why I link, like, if you have poor oral health, then that's where the 7 years of your life could be taken away from you, right? With heart disease and whatnot.
I remember we were taught in residency that patients who have no teeth had a significantly lower incidence of lung abscesses.
Yeah.
Because there's nothing for it to
I read
come
that
from.
study.
Yeah.
That's interesting.
Mm-hmm. Now, one of the things that we also counsel our patients on is avoiding the use of antimicrobial mouthwashes. And that seems to be very popular now.
Like avoiding Listerine.
Avoid.
Yeah, avoid.
Yeah,
Definitely
avoid.
avoid them.
Yeah.
Especially Listerine that has alcohol.
Yeah.
Right.
Because alcohol is going to dehydrate your mouth. And what do you get in return when your microbiome gets in the oral cavity gets altered? You're going to have an increase of yeast infection. I mean, we all have Candida albicans as part of our natural indigenous oral flora, but when you kill good bacteria that you need in order to process and digest your nutrients, you're going to have an increase of these opportunistic Candida albicans, and treating fungal infection is even more tedious than keeping a healthy mouth, by frequent hygiene appointment. Hence the reason why in our hygiene appointments, we incorporate ozone irrigation, because ozone irrigation would be very specific and won't disrupt the microbiome. Why? Because ozone has a negative charge. Usually inflammation.
Can you explain, I guess ozone is 3 molecules of oxygen,
yeah,
right?
there are 3 atoms of oxygen, highly active. Unfortunately, at room temperature, they're detached, so we produce ozone, and we ozonate saline for our irrigation in our patients constantly throughout the day. And even right now, I'm giving a patient his 2-year-old kid developed rampant cavities, and she's trying her best to feed him good food, but the baby was born with developmental dentinal issues. So I told him, listen, what we can do is bring me a bottle of water. We'll also need it, and then make little cubes, because he's in an eruptive phase too, which sucking or swishing with the eyes will have that disinfectant effect without killing the good bacteria. Because why it doesn't kill good bacteria? Because good bacteria won't have a positive charge. Inflammation and bacteria, viruses, and protozoas, like parasites, they do have a positive charge. So ozone has a negative charge, and it's able to neutralize that.
It helps bind it, right?
Exactly.
Like, okay.
What's your recommendation for people with chronic bad breath?
Well, if it's a dental-related issue from disruption of the microbiome, definitely start healing microbiome with pre-probiotics, change their lifestyle with a more raw, natural diet, avoid anything that can be pro-inflammatory like seed oils, prevent gluten, dairy products at most as well, and level up the nitric oxide levels, and treat if they have active gingivitis or periodontal disease. Because that's one thing that these patients are completely unaware, because they get used to their bad breath. And halitosis could be produced from these dearrangement or dysbiosis of their natural bacteria. If that doesn't treat, we're looking into H. pylori. We're looking into mouth breathing. Okay. Maybe a patient has sleep apnea. Maybe a patient has a tongue tied, is not able to create that palatal seal by moving the tongue to the roof of the mouth and activate vasovagal breathing through seal of the palate, where you should consciously move the tongue to the palate because they're tongue tied. So we recommend patients, to see from that anatomical perspective if that's hindering their breathing. Mouth taping as well is very helpful. And also the gut microbiome, if there's and alcohol too can cause that because of the dehydration process.
So we've talked a lot about different conditions and how the link with oral hygiene, but I'd like to talk about now like technology and innovations, and what tools do you use in your practice? Like, what's it like when a patient comes to you for their consultation or their first visit? Well,
one tool that for me has been very helpful with the diagnosis and proper counseling and derive an ideal custom treatment for my patient is having a CT scan. Combine technology is digital, so we reduce radiation, and at the same time gives us that third plane for proper diagnosis of oral infections and root canals that might be failing. But the problem here with root canals is they're not going to cause you any pain until there's severe destruction of the bone that's perforating through the periosteum, and that's when patients are going to start having pain. At that time, that's really affecting, your cardiovascular system as well. So with sometimes patients said, oh no, I'll take the CT scan if I really need it. So we start with the 2-dimensional digital x-rays, but a 2-plane x-ray versus a 3D is a total different ball game. I mean, the diagnostic quality and be able to assess roots and not have the overlap of all the cranial bones impeding a proper evaluation of tooth by tooth. It's incredible. And also helps us diagnose cases of chronic inflammation of the maxillary sinus, because a lot of teeth can drain once they're going through oxidative stress, produce fermentation and pus. They will tend to find the path of least resistance. For upper teeth, it's usually the maxillary sinus. And once they get into the sinus, we're very close to the brain. These are very dangerous conditions. Hence the reason why root canal teeth can never render a tooth sterile. And this is a concept that unfortunately we're not being supported by the American Dental Association. There was a documentary that was created talking about the dangers of root canal back in 2020. and it was taken out by the they put pressure from the American Dental Association, and the dentists complained about it.
So it was removed.
Yes,
Yeah.
but this is a documentary. You can still find it on Tubi, and I highly encourage you to read it. Another incredible book about the hidden epidemic, about these hidden infections in the mouth, by Dr. Thomas E. Levy. He's a cardiologist, so he's not even a biased professional from the dental field. He's a cardiologist that sees that all his cardiac patients had a culprit or a etiology because of teeth infections in their mouth.
Yeah.
And he encouraged those patients to see biological dentists for proper diagnosis by the use of a CT scan or beam tomography.
So what is cavitation? And how does that affect everything?
Well, a cavitation, the term cavitation means it's a hole in your jaw that has not filled with new mineralized tooth structure.
Okay.
Why it happens? One is because your immune system can be affected. It's not causing your stem cells to produce new bone-producing cells. Osteoblasts don't turn into, stem cells don't produce into osteoblasts. And one factor that can happen is inappropriate extractions, where the surgeon or the practitioner didn't scrape off the periodontal ligament. The other factor as well could be in cases of smokers, even marijuana smokers, that can cause a early on vasoconstriction in the wound area, so they don't get blood supplied to the socket, to the alveolus, so they're not able, they don't bring blood, they're not able to build up bone tissue. These areas, commonly diagnosed by mainstream dentists, will call it, it's a radiolucent area or a scar tissue. And that's not true. That's not scar tissue. This is areas where there's still production of inflammatory proteins that can cause an increase of oxidative stress and produce chronic inflammation. And not only localized in the jaw, but in distant organs. That's when we go back to Chinese medicine, connecting teeth to several organs and systems through the meridian fields of energy. And it's very interesting because when patients come and say, hey, my big toe gets swollen, I'm already thinking this is a lower molar infection, you know?
Wow.
I have in the office about 33 cases of females diagnosed with breast cancer. What they had in common, each one of these cases had a root canal that was failing, and the infection was possibly correlating to the damage of the DNA because of the increase of the oxidative stress in the body.
Wow.
But interesting enough, you take those teeth. I mean, I even had a prostate cancer patient. All I did was just to remove the mercury filling. The patient changed completely his lifestyle, cut sugar, start juicing, ate raw, food that requires chewing.
Vegetables.
And after a year of removing the mercury and him changing his lifestyle, the case went into remission. They couldn't find a single cancerous cell in his prostate. He refused chemo, refused surgery, refused radiotherapy.
Wow.
And he was referred to me by his daughter, who was a physician. He said, this is my last resort. At least do something. Maybe it will help.
Right.
But the patient, too, has a very optimistic mindset about life, about beating anything. And this is what I think epigenetics plays such an important role. Because if you think that you can heal, you heal. Those are the patients we love to help, because their mindset and their spiritual and their energy, or call it divine intervention, is gearing already to a path where your cells are reorganizing towards the main purpose of healing the patient.
I couldn't agree more. I love that kind of story. And I hear that all the time, and that's why, people, it's not just about taking a pill for this or getting something removed, right? Now back to you talk about some of the vasoconstrictors, like smoking, right? Smoking, cigarettes, or even marijuana. Now, what about like Adderall? What about all these like stimulants? Those can also cause like dry mouth. Like, do you see a correlation with medications like that?
Yeah, absolutely. And even antidepressant, the serotonin reuptake inhibitor drugs, we see increase of involuntary muscle contraction, increase of bruxism, which is grinding and clenching of teeth. So, I mean, some of these grinding and clenching could have a parasite origin as well, or airway issues, but for the most part, is chemically mediated contraction of the muscles, causing damage of the teeth. And going back to technology of teeth, what's the technology we offer? Well, first of all, you want to get to the root cause why they're grinding their teeth. Second, if they broke a tooth, you want to restore that. Minimally invasive with materials that don't have BPAs, don't have fluoride. Ideal are ceramics. And from ceramic, there's different type of ceramic. Zirconia is the most inert and more biocompatible because it doesn't have a negative charge, so it doesn't magnify any of it, what we mentioned, EMF and radiation as well, versus other type of ceramic that even have aluminum oxide to prevent propagation of cracks within the ceramic content.
Which is the one that's used the most today?
I use zirconia. And even we talk about implants, zirconia, it's our most biocompatible replacement of the root of the screw, the titanium versus titanium.
Wow. And then you talk about vasoconstriction as well before with those, smoking and medications and things like that. Which affects blood flow, right, to the area of concern. But that's another thing that we love about NO, right, nitric oxide, because it's a vasodilator, and it helps, like, bring blood to the area.
Yeah, this has been one of my experience, patients that experience a little bit of delay healing after extractions. And I say, let's test your NO, because it's probably very low. And as soon as they start supplementing, they start healing. Because our patients are already doing infrared therapy and a lot of alternative biohacking therapy. So sometimes they're deficient in nitric oxide.
I think this has been phenomenal. I feel like we could continue to talk with you forever and ever.
Part two.
I know. I still have so many more questions I want to ask, but I'm just going to have to make an appointment to see you.
Absolutely.
And
so can get together again.
The one thing I would love if you could answer, how could somebody make, like, what's one simple change that somebody could make to improve their oral health and overall health today? I'm putting you on the spot.
That's a really good question, because I think in terms of myself, because when you overdo something, you also get this, on the other hand, the side effect of it. Prevention, for me, key is we live in a very fast-paced life. Sometimes we need to stop, breathe, and smell the roses. From a dental point of view, the teeth were never considered part of our respiratory system. And the more I learned about how position of the teeth could impact your airway, I said, I had to control my stress level, not be on a flight or fight reaction. I had to stop and breathe properly, position my tongue and the roof of my mouth to activate that nasal breathing. Along the way, of course, brush your teeth twice. Brush your teeth in the morning before you have your breakfast, okay? Never brush right after breakfast. Most people have a very acidic breakfast quality from the coffee, or if they eat cereals, which hopefully that's not the case, because you want to break your fast with protein, not with carbohydrates. So
I couldn't agree more.
Glucose level doesn't spike up, but brush your teeth before breakfast. And the second most important is brush your teeth before you go to sleep. And don't eat anything. Don't disrupt your melatonin levels with production. But I think that's a simple way, because sometimes I talk to patients, I've that been my patient for over 20 years, and they go, I didn't know I was not supposed to brush right after breakfast. No, because you don't give enough 30-minute time that you need in order your pH of your saliva to stabilize and be buffered or become alkaline again. If not, you go erosion from the exposure to acidic levels of your coffee. And second, or most of us, we do lemon juice.
Right.
Yeah.
So you don't want to go and brush because now you have the erosion from the chemical exposure, and then you have the physical abrasion from removing mechanically with your toothbrush.
Yep.
So that to me has been like, oh my God.
Right.
That's
You
great.
know?
Awesome. Well, thank you so much for coming on,
Oh,
Dr.
you're
Yani.
welcome.
Could you tell our audience a little bit, like, how can they find you? How can they get a hold of you? Do you have social media? What's your website?
I own my dental practice in downtown Fort Lauderdale. It's called Green U Dental. And why I call it Green U Dental? Because we're the green sheep in the dental field. I didn't want to call black sheep, you know. But we're on Instagram. You can find me at Green U Dental or Yani DMD, which I have 2 profiles. And we are on our website too, greenudental.com.
And what's your office phone number?
954-525-6010.
And I'll have all that in the show notes as well.
Oh, thank you.
Thank you
for having me.
Thank you for coming on with us.
Pleasure.
The information contained in this podcast is provided for informational and educational purposes only and is not intended for the purposes of diagnosing, curing, treating, or preventing any disease. This podcast is provided on the understanding that it does not constitute medical or other professional advice or services. Before using any products or services referenced on this podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the products. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Dr. Brian Marias, Deanna Weilbacher, and Hybrid Medical Solution, do not claim responsibility for any adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for any statements made by the guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referenced.
If you would like to submit any questions or if you have any topics you would be interested in hearing about on future episodes, please contact us through our website, www.hybridmedicalsolution.com. That is solution with no S at the end. Follow us on Instagram and Facebook, all under Hybrid Medical Solution.